let me just flesh out exactly what Congress was doing, because honestly, I didn't understand why this individual mandate existed until I started getting really into the weeds and arguing the case. So Congress was reacting to a problem in which there are approximately 50 million people who are uninsured in this country, and they're priced out of the insurance markets. And a large part of that has to do with discrimination against those with pre-existing conditions. That if you're in one job and you try and switch your job, you can't really do so because that other employer looks at you and says, oh boy, this person has all sorts of, this person has high risk and so on, and so the insurance costs for them are too high. So 50 million people approximately are uninsured. Congress comes along and says we're going to eliminate the discrimination against those with pre-existing conditions and insist that everyone be rated at a certain level in a community so that you can't stick the bill too high to particular individuals. Now the problem with that is once insurance companies are told, well, you've got to insure folks and at a fair cross-section of the rate, then everyone could just wait to buy insurance until they got sick. You'd wait until you got to the hospital before you had to sign up for insurance, and then that way you'd economize on your costs until you got sick. Well, that obviously would create massive adverse selection problems, and did in the states that tried to reform the insurance markets through pre-existing discrimination bans and the like. So what Congress did is they said, we're going to have an individual mandate so that everyone has to have a certain amount of insurance precisely to avoid that adverse selection problem. Right now, Congress found approximately every American family spends about $1,000. Every American family who gets health insurance pays approximately $1,000 extra to pay for those who are uninsured, and those costs spread across state lines. And so that's really, I think, what Congress was saying when they said that this is part of their commerce power, that health care is approximately 18% of the GDP. And this is a comprehensive regulation of the health insurance markets. Now, Paul says that the example that resonates with him is that why didn't the government do this with respect to the automobile industry? The automobile industry is really different. I mean, that's not a situation in which you can show up at the car lot, drive off with a car, and stick your bill to your neighbor. That's what's going on in the health insurance market. That's what Congress found, that the uninsured are going into emergency rooms, and you and I, who are paying for health insurance, are effectively paying for them. And that is an economic effect that is real and present right now.